Here's Hakeem Jeffries talking, making quite possibly the dumbest argument I've ever heard about the shutdown. Like, nothing you're about to hear is accurate or true. I'm playing it more just to make fun of Hakeem Jeffries because, let's be honest about it, there are people on the left that are really stupid, like AOC, for example, or Jasmine Crockett, or what's his face, the guy in California that slept with the Chinese spy. Those people are just morons, okay? I don't think Hakeem Jeffries is a moron, but he is a giant zilch. He has no gravitas whatsoever. He does not seem to really be good at this. I don't know why they chose him. I really don't. I mean, Nancy Pelosi was not a great communicator, or certainly was terrible on policy, but she did have a way of wielding a lot of power behind the scenes. So there's an argument for her as House Speaker. I don't know what the argument is for Jeffries. He just seems to suck at all of this, but here he is sucking.
Donald Trump definitively needs to get involved. He needs to get off the sidelines, get off the golf course, and actually decide to end the shutdown that he's created, that he has allowed to happen. We know that House and Senate Republicans don't do anything without getting permission from their boss,
he says this
Donald J. Trump.
Same stuff every day.
And the reason why there have been no negotiations, zero negotiations, since Republicans shut the government down, is because Donald Trump clearly wants the government shut down. He wants to inflict pain on the American people.
It's impossible I don't have the time to go through every one of the dumb statements there, but like, the Republicans have voted to open up the government many, many times. I think 12 now. They wanted to, and this is against what I want, by the way. To be clear, I don't want these funding levels to continue. I think it's bad. I'd rather have the government shut down. When he's saying, hey, you want the government shut down, that's what Trump wants. I want it. They don't want it at all. They keep voting over and over and over again to reopen it. And of course, when it comes to negotiations, like, they have actually offered multiple times to have debates and negotiations about these dumb issues Democrats are bringing up. However, the Democrats have voted that down every time. They want it to happen now. Why? Why do they want to keep this going on? It's interesting to know. By the way, how is everything working out? There's one theory, and I think there's some validity to this theory, and I think it's an interesting one, which is the reason why Democrats are starting to maybe panic a little bit is because their polling isn't so great on this. Harry Enton made a point like this on CNN. Also, the latest Reuters Ipsos poll, this one closed Monday, shows 42% of Americans approve of Trump's performance in office, up 2 points from a survey conducted earlier this month. The president's approval rating last hit 42% in early September. Now, the argument basically, presented by Enton and others is, hey, this isn't really hurting the president like it has in previous shutdowns, so he's not that worried about ending it. And maybe that's true. I will say, Trump kind of solved Middle East peace in this process as well at this timeline. So a couple of point bump might be more of a reflection of other things going on than the reaction to the shutdown, which really hasn't had a lot of attention drawn to it. At least that's the way I perceive it. In the poll, 50% of all adults blame congressional Republicans, 43% blame Democrats, 7% skip the question. Among Republicans, 84% say Democrats, 14% on their own party. On the other side, 89% of Democrats blame the GOP, 9% blame their own party. The independents, 51% blame the GOP, 34% blame Democrats. So again, it kind of supports the idea that the polling situation hasn't been super damaging to Republicans, but they're still getting blamed more than Democrats. And when you factor in all the good things that have happened with Trump, particularly in the Middle East over the past couple of weeks, shouldn't it be up more than 2 points? And this is why I'm coming to a theory here, because this all relates to Obamacare and health care. At least that's what the Democrats want to say. Part of this is them just pleasing their base. They had to come out and do something. They had to fight back to show they've got the fight or whatever. But their presented reason for this fight is related to healthcare and what the cost is going to be on people. John Thune, Senate Majority Leader, kind of outlined what the argument from the Democrats is, and this is basically the truth of the situation. Here's John Thune.
It is truly amazing how a program Democrats created and tax credits that they chose to sunset have now become the Republicans' crisis. Republicans, in fact, never had anything to do with it. Democrats created Obamacare. alone. They implemented the enhanced tax credits alone. And they chose a sunset date for those tax credits alone. Democrats are solely responsible for the Obamacare tax credit cliff. And yet they're trying to pin this disaster on Republicans while at the very same time they're asking Republicans to bail them out.
Now, he's right on every part of that, but the part I want to focus on most is they chose a sunset date for those tax credits alone. They did, right? And you don't remember how this worked. Obamacare was passed back in 2009, 2010, whenever that was. It made it through. Republicans tried for a while to fight it. As we predicted at the time, they will eventually stop trying to fight it, and they will embrace subsidies because this is what everyone does. So you get a program, you get free money, you want that free money to continue. Of course, we also predicted at the time that the Affordable Care Act would be anything but, and it has become anything but. In fact, we know that now because even the Democrats are saying it's unaffordable. They are saying that if we go back to Obamacare, which is basically as passed, that is the situation if we do not extend these tax credits. It will be a catastrophe and all these people will be miserable. Well, that's your plan. It's your Obamacare. You're the one that wanted that. So what they're saying is either we get all these new credits or we go back to this terrible thing that we invented. Now, what's important to focus on with Thune's quote there is the timeline of this. Obamacare exists. It runs for a long time. COVID happens. During COVID, and this is not during Trump, this is once Biden gets in office, his first big bill includes a giant chunk of money to go to free Obamacare or discounted Obamacare. Massive subsidies going to Obamacare. The justification at the time, we're on the very tail end. In reality, we're kind of past it. In some blue states, though, you were still having some school closings and work closings and stuff like that. There was still some hesitation, some closing and hesitation as far as fear goes when it comes to COVID. That stuff's going on. They put these big subsidies in for a year. And they say, okay, we're in the middle of a crisis. We need to have these for a year. Then that year comes up and it's about to go away. And the Inflation Reduction Act occurs. And Biden comes in and says, you know what? We need to extend this. I think it was 4 more years, ending in 2025. Again, they selected the dates. These tax credits go away, knowing, hey, where are we going to be in late 2025 going into early 2026? We're going to be going into a midterm election where we might not be in power. We need to have something to be able to fight with Republicans on. We need to be able to things to accuse them of. So they knew this would go away. Either they're in power and they can continue them, or they're not in power and they can use them as a cudgel against Republicans. That's, of course, what they're doing right now. They're in the middle of doing this. Now, they know this because they know how important healthcare costs are. They're very, very high on people's mind. Here's a poll from AP. Top of the mind, what is the most extremely and very important issue? Number 1 is the economy. Number 2 is healthcare. 84% said the economy. 81% said healthcare. 72% crime. 58% immigration. 57% gun policy. Abortion. 49%. Climate change. 42%. Transgender issues. Way down. Half of everything else. Just to kind of put that on your radar, only 20% said that mattered to them. So this is what Obamacare is. These subsidies are just this thing we kind of stapled onto Obamacare to say, hey, we're so sorry about how Obamacare was turning out. You should have extra subsidies stapled on under the auspices of COVID. Tim Carney wrote about this. Insurance subsidies are a costly fix to Obamacare's leaky ship. During the 2020 election, Democratic presidential nominee Joe Biden proposed a fix, increasing subsidies for everyone below 400% of the poverty line. Are you freaking kidding me? And extending the subsidies to wealthier customers so as to get rid of that tax credit cliff. Pandemic provided an excuse for this effort to save Obamacare's exchanges, and Biden's American Rescue Plan established these extra subsidies as temporary. But as the crisis requiring this fix, the death spirals in the exchange, the general ballooning of healthcare spending was not temporary. This was always supposed to be a permanent fix to Obama's leaky 2010 healthcare law. More on that in a moment. When the prime time came for Democrats to make the extra subsidies permanent, they faced an obstacle, Joe Manchin. The misnamed Inflation Reduction Act was Democrats' vehicle for extending these subsidies, but West Virginia Senator balked at the price tag. Democrats had to make the bill less expensive to get his vote, So they reduced the 10-year price tag by extending the subsidies only till the end of 2025. Here we are in 2025, Democrats figuring they can use the prospect of skyrocketing middle-class and working-class healthcare premiums as a cudgel in which to attack Republicans. Exactly what we were just talking about. In this fight, Democrats have had a quiet ally, the health insurance companies. The extra subsidies are not tax credits to insurance customers, but transfers from the Treasury to private insurance companies. Wonder why that didn't work out. These subsidies have given the insurers more customers, driving up enrollment, and also made customers less price sensitive because Uncle Sam was picking up part of the tab. I've never understood the argument that this is going to be bad for insurance companies. You know, millionaires and billionaires, the tax companies are going to, these insurance companies are going to, hate Obama. Why would they hate Obamacare? You're legally requiring them to be customers. I would love that. If I was like running a McDonald's and we passed the required Big Mac lunch once a week bill, you'd be kind of thrilled if you were McDonald's, right? I mean, we're going to sell a certain amount of Big Macs no matter what. That's what happened with Obamacare. Now, the question here, now that they set this timeline up where they know they can beat Republicans with these raising rates that are their creation, what do Republicans do? What do Republicans do? Marjorie Taylor Greene sounds alarm over expiring healthcare subsidies as shutdown continues. Marjorie is in favor of the subsidies. Now she's still complaining about Obamacare, which that's great. But she's saying, well, this is a real problem when we do have to get some money over to these people. At least that's how her argument is being presented. I'm sure there's a little more nuance to it than that. But Ro Khanna doesn't see much nuance. She says, I agree with Marjorie Taylor Greene on health care. Bipartisanship, boys and girls, always good outcomes from bipartisanship. Always remember that. Here's Ro Khanna talking about this particular issue when it comes to subsidies for health care and Marjorie Taylor Greene. And it's important to understand, listen to the way he frames this. Watch.
We cited the example they had last week where they said even if the subsidies expire, 80% of subsidies are going to be covered, or 80% of the premiums are going to be covered by taxpayers paying these subsidies. Why is the system, when we were told it was going to really improve everything and make things more accessible, why is it in such dire financial situation that it would take 80% of it being underwritten by taxpayers for it to continue?
Because the insurance companies are ripping us off. They've had $171 billion of profits. They've got their CEOs making about $170 million. Now, I supported the Affordable Care Act, and President Obama said we can't have people having cancer not be treated. We can't have young kids not having insurance. But it was a humanitarian fix. It wasn't a fix to the system. The fix to the system is to get rid of these private insurance companies that are hurting our companies, hurting our manufacturers, and fleecing the American public, and have everyone have Medicare for all, and then you can have supplemental private insurance. That is the fix to the soaring costs.
Oh, I see. So Obamacare wasn't about solving the problems of the healthcare system. It was about a humanitarian fix until we got to the main solution, of course, which is Medicare for all. You'll also know that as a single payer program. Where have I heard this before? Where have I heard this before? I know, I've said it a bunch of times. Glenn Beck has said it a bunch of times. Lots of conservatives have pointed out this could be an issue. But I remember this specific approach to Obamacare turning into a single-payer program. Where did I hear that? Here's a clip from 2008 at the Tides Foundation.
Someone once said to me, this is a Trojan horse for single payer. And I said, well, it's not a Trojan horse, right? It's just right there. I'm telling you, we're going to get there. Over time, slowly, but we'll move away from reliance on employment-based health insurance, as we should, but we'll do it in a way that we're not going to frighten people into thinking they're going to lose their private insurance. We're going to give them a choice of public and private insurance when they're in the pool, and we're going to let them keep their private employment-based insurance if their employer continues to provide it.
It's not a Trojan horse. It's just right there. I'm telling you, this is what we're doing. And of course, this is what they were doing, and it's what they're in the middle of accomplishing if Republicans don't come up with a backbone. And here's the problem. We're seeing some Republicans flake off already. So what's the strategy here? Why haven't we heard all of this coverage? Quickly, I'll give you an outline of this. Democrats are, I think, keenly aware of this date. They know this date is coming. They know when people go to sign up for their Obamacare that they're now dependent on, they're going to see the rates a lot higher than they were last year. they're going to go back to the rates that they had in 2018 and 2019 when it comes to a percentage. Those numbers are going to be a lot higher now. That is going to create a backlash, and it's going to create pressure. Democrats, instead of complaining about all the sob stories of the people being laid off this time when there's a shutdown, instead have just been talking about health care. They want to be known to everyone as the one trying to fix your health care problem. Well, what happens when these rates go up? What they're betting on is that Republicans will fold. Why? Because they usually do. Because they usually do. They've already folded on even attempting to get rid of Obamacare. That November 1st deadline is what, 11 days away? When that deadline, and deadline's the wrong word for it, the beginning date of signing up for Obamacare, this is when they're first going to see these rates, and they're going to get slapped in the face with them. Democrats have been waiting, I think, for this the entire time, and they're waiting patiently for this to kick in because they know they have some leverage coming. And people like Marjorie Taylor Greene at least give them credit for knowing the politics of the situation. No, this is going to look bad for Republicans. They're going to start getting blamed. They're going to go down the wrong road, which is going to and is already creating a situation that Republicans may very well fold. Trump, when he believes in something, he doesn't fold. He really believes in something, he doesn't fold. But I don't think this is central to his ideology. Healthcare subsidies. I mean, he doesn't care about spending like maybe you or I do. That's just not his approach to things. He'd rather try to grow his way out of the problems. I don't think that's, possible here for a bunch of different reasons we don't need to get into. But I don't think he's going to just necessarily fold. I think you will see some folding going on the Republican side, and this is what the Democrats are going after. So it's important for us to kind of get out in front of this and say, hey, we know this is coming. We know this November 1st date is coming. Time to wake up and make sure that we do not fold on this issue because it's way too important.